Lots of people these days are combining both conventional medicine with alternative therapies to achieve optimum health. Well, in this next roundtable discussion, we see how East meets West and how old meets new. We're here today to try and understand integrative medicine, the two different alternative and the conventional medicines coming together. Can they work symbiotically?
Well, I think they can, and I actually like the word integrative medicine versus complementary or alternative, because you can work together. There are a variety of therapies, reflexology, massage therapy, yoga, just to name that side of different type of therapies that you can certainly work in coordination with a conventional physician. But the key is making sure that everybody's on the same page and parents telling their doctor that they're trying some of these things.
Not only can and should they be working together, I mean, they must be working together. This is a part of the future, not only economically, but therapeutically, even philosophically.
And even insurance companies, mine anyway, is saying that chiropractic can be covered, acupuncture can be covered. So we are seeing more recognition that these are valid therapies.
Almost every medical school in America, all the best medical schools, now have courses in alternative medicine.
Right.
Talk to medical students. They are in large numbers interested in integrative medicine, and this is the future.
What is most appealing to me about homeopathics is the principle that you're treating the whole body, both physically, emotionally, and mentally, and believing in the ability for the body to heal itself. And I believe in the gentleness and the safety with homeopathic medicines.
So the FDA approved these medicines.
Sure.
They do.
The FDA actually was created in large part from legislation from a senator in New York who happened to be a homeopathic physician in 1938.
And so the AAP then is okay with homeopathy?
Well, homeopathy falls into a category of complementary alternative medicine or integrative medicine, which kind of connotes everybody coming together from different healing arts. And the AAP does acknowledge that. In fact, there is a section of committee members through the AAP designed for holistic, integrative, and complementary and alternative medicine. Now, that doesn't mean that they're endorsing specific products, but it does mean that we acknowledge that these healing arts exist.
Ultimately, integrative medicine takes the best from all worlds, though the emphasis is also in honoring the Hippocratic tradition. Hippocrates, being the father of medicine, emphasized first, do no harm. So we should exhaust safer methods before resorting to the bigger guns of conventional medicine.
It's interesting, first, do no harm. It seems to be every day that there's some scare about some particular medicine. At the moment, it's been the cough and cold medicines for the under 2s being recalled. And like there are statistics that could blow your mind with the misadministration of prescription drugs, whether it's in hospital, whether it's at home with antibiotics. What's going on at the moment, Dr. Brown? Why are we so concerned and confused?
Well, I think that there's always a hot topic in the media, and so perhaps right now there's more scrutiny being paid to medications and medical errors, and I think healthcare in general is under quite a bit of scrutiny because it's so darn expensive. And but don't get me started on that one.
Don't get me started on that.
That's a huge political and it has a lot of issues that affect all of our daily lives. But I think that there are a lot of other things that are under scrutiny too, and I think that people need to be educated and informed consumers of their health care, whether it's conventional medicine, whether it's integrative medicine, whether it's homeopathic medicine. And what concerns me, and Dana just made a comment, he said, before you resort to the big guns, that conventional medicine is a big gun. Well, not everything I do is writing a prescription. So, being a conventional medicine doctor means that I'm doing well child visits and anticipatory guidance and preventative health care, and I wouldn't consider that a big gun or something that's not safe.
Going back to your other question about the daily dramas that we hear about drugs doing this or that, I'm concerned about the amount of drugs that children and everyone is being prescribed. The Kaiser Foundation estimated that every man, woman, and child last year was prescribed 12.6 prescription drugs. And if you didn't get your 12.6 prescription drugs than someone else did. Now, the problem that I see is that all too often doctors and consumers see symptoms of illness as something wrong. Actually, from a physiological point of view, that fever, that inflammation is the defense of the body. It's the way that our body-mind is trying to fight infection and or adapt to stress. So instead of using drugs to suppress the symptoms, we should look to mimic the body's own wisdom. And that ultimately is the premise of homeopathy. And I think the reason why a lot of people throughout the world, not just in America, actually it's much more in Europe and in Asia, where homeopathy and natural medicines are really part of mainstream medicine there, is because they respect that wisdom of the body.
So it's listening to the body's need. But as a parent who treated their child with a homeopathic remedy, how are you listening to your child's body?
As Dana just mentioned, suppressing the symptoms was not going to be good enough for me. It was an absolute nightmare. We were not sleeping for longer than 20 minutes at a stretch. My child would wake up in absolute pain. He was not a fussy baby. He was truly a hurting baby, as Dr. Siertz describes them. I was breastfeeding. We tried diet elimination to see if there were food sensitivities involved. We tried everything from massage, aromatherapy, warm baths, swaddling, skin-to-skin contact. And I went to the pharmacy, of course. That was the next step. I got the gas drops. Nothing worked.
So how did you find your remedy?
I tried several homeopathic remedies in Europe that worked very well for me. And because my constitution obviously would be similar to my child's, I decided to try those. First and foremost, I came up with a very rough prototype, which worked pretty much miraculously from the first dose.
Were you not petrified of giving too much or too little, or in the wrong combination? Or
I spoke with many doctors before I decided to put this together myself.
It might be helpful, by the way, for me to explain one important thing about homeopathy to understand its history of efficacy and research. Homeopathy is based on what's called this principle of similis. What a substance causes, it will cure. Immunizations and allergy treatments use that in conventional medicine, like to treat like. In homeopathy, we might use a substance called belladonna. Now, belladonna can and will cause inflammation, it will cause fever, it will cause colic, and yet in very small doses, it will help reverse that.
Milli doses.
In what we call nanopharmacological doses, in nano doses.
With conventional medicine, our mantra is show us the science. Okay,
so
you show me the scientific
right.
study that proves that this works and proves that it's safe, and I'm interested in trying it for my patients.
I'm concerned about science too, and all too often, however, children and adults are prescribed more than one drug. And usually the science isn't done with 2 drugs or 3 drugs or 4 drugs, and yet the average American, when they're on a medication, are on multiple medications. You throw the science out the window.
If you're talking to doctors and you're trying to get us to embrace other therapies, you just have to speak our language.
But what if there isn't a study, and there isn't for this particular product, but there is no adverse effects? Like there's only been good. Is that not maybe okay as well? Because, what harm can it do?
If people feel like, this product is safe because it's a homeopathic product, I probably wouldn't have a problem trying it, but I'm not going to go out there and recommend it. One of the things that the National Institute of Health is doing now is that they have a National Center for Complementary and Alternative Medicine and a website which is phenomenal that actually grades some of these other remedies so that you can look and find the scientific research.
Traditionally, maybe we thought that conventional medicine and maybe alternative practices were mutually exclusive, but that's not the case.
We can get along, work together for the benefit of the patient.
I think it's very important for the parent to get actively involved, especially when it concerns the welfare of their child. I mean, you are your child's best advocate.
Thank you all so much for coming on the show. Thank you. Did you know that when children start learning languages at birth, they have the capacity to learn many languages at once without getting confused? And not only is learning a foreign language easier for children than adults, it can also lead to better grades in school, improved problem-solving skills, a more diverse view on life, and an appreciation for differing cultures. For more fun facts, visit our website at wliw.org/RealSavvyMoms.